पहला स्टेप आज ही एग्जाम दे रहे हैं ये सेशन खत्म होते होते एग्जाम खत्म. So first is we check for the response of the patient. Oh, any victim or any person is there, we check for the response. Okay. After that, उसके बाद क्या है? इनको सामने ही रखता हूँ. हाँ? Early recognition, then activation of the emergency response system. Then we check for the scene safety. Okay. After scene safety, how do you check? Why do you check for scene safety? In case of any fire, in case of any water, in case of any open electrical wire there, or in case of any vehicles in the road, on the center of the road, those things. Second is check for the response. How do you check for the response? How do you check for the response? Tap shoulders with a firm voice, okay. At the same point of time, we activate the emergency response system. After that, what we do? We check for pulse. We check for which pulse? Carotid pulse. How do you check for carotid pulse? Two fingers, slide into this groove, we check for this pulse. Okay, how much time you will check for the pulse? Minimum 5 seconds. Now, where will you position yourself while performing chest compression? Side of the person. How will you check for the midline and where you will place your hand? Sternum, mid sternum, at the lower end of sternum here. Okay. How will you place your hands? Hand should be locked, dominant hand down, and you should give CPR with your body weight with the back, right? Okay, not with your hands, because if you give like this, you will get fatigued here, right? After that, what we'll do? How many chest compressions we perform in a one minute? 100 to 120 chest compressions. What is one cycle of CPR? 30. After 30 compressions, what we'll do? 2 breaths. And how many cycles of this thing? 30 is to 2? 5 times. So at least, and this will last for how much time? At least 2 minutes. Okay. And we avoid any interruptions in between. Minimal interruptions will restore the circulation faster. More of interruptions will again, you will have to restart from again. Okay. So fainting is different. At that point of time, also you check for the response. It is also you checking the response. If you tap the person, if the patient is getting away, it is fine. That point of time, you check for the pulse. You check for breathing. When you are checking pulse, at the same point of time, you look at the patient's respiration. So when you check your pulse here, keep your hand here. Look at the patient's nose. Check for the patient's chest. Is it getting? Is there any chest rise or dip? If you see a chest rise, patient is breathing. Okay, and same point of time patient is having pulse, then we can rule out other causes, right? So stressful work and everything, then those factors are there. This CPR has to be performed where? When there is cardiac arrest. So what was the definition of cardiac arrest? I told you two things. One is cardiac arrest and one is respiratory arrest. So cardiac arrest was no pulse, no respiration. Respiratory arrest was there was breathing, or there was pulse but there was no respiration, right? And combination of both is cardiac arrest, what we say. If you don't have a pocket mask, then we can go for a mouth to mouth respiration as well. Okay, same where you have placed yourself at the side of the patient, at that point only you can head tilt and chin lift and give mouth to mouth respirations also.
Cheaper, 200-300 rupees you can keep it. You have to hold it like this. E, hold jaw, and C, press it from upper side. And hold it. So you will give you can see chest rise.
You are able to see a chest rise here? Okay. So while holding the mask, if you see how he is holding, yeah. So there is a C and E technique there. You see his index finger and thumb is making a C over the mask. Okay, this C, and with this other fingers he is making a E and holding the jaw at the same point of time. So this is C and E technique which we usually follow. So this is to give a complete seal of the mask over the face. ठीक है. So once we have this mask with C and E technique over the face, then we give a breath. So during the breath, we hold, will not give CPR or will not give chest compression at that point of time. We'll give 2 compression, then again we'll restart CPR. Similarly, we can give ventilation. If there is any obstruction there, we can give ventilation through the nose as well. Okay. And we can use always a barrier device. Barrier device as the mask or mouth-to-mouth respiration. If you feel that you're not comfortable at that part, you can just keep your handkerchief over the patient, because at that point of time, saving life is more important. So already I told you one cycle of CPR is 30 compressions and 2 rescue breaths, and we perform 2 cycles of CPR. If we have single provider, he usually completes the 2 cycle. At that point of time, he will be still calling for help. If we have 2 rescuers, they can switch their roles. So one is giving the breaths and one is giving the chest compressions. Till when should we continue CPR? Till any qualified help arrives. Okay. And which number to dial for qualified help?
108.
So which number you will be dialing next time? It's 108. Again, after this, if you have a defibrillator, what is the automated defibrillator? Automated defibrillator is a device which usually detects irregular pulse. Okay. It will not defibrillate in a arrested rhythm. It will only detect irregular pulse. Why we need an automated defibrillator? Many a times what happens is, in case of arrhythmias, any arrhythmias or any irregular pulses there we have to defibrillate the patient to regularize the rhythm. Okay. For that the defibrillator is used. Okay. So AEDs are regularly available it's a mandatory norm that AED should be available with you in the office or in the workplace or in your major buildings. Okay. And these AEDs are usually designed for lay people only. Okay. Medically we can use a defibrillator. We have a medical defibrillator there, which we have. This is this defibrillator here. This is to restore irregular rhythm. Current, if there is any irregular rhythm, that only will be detected with the AED. Okay. If there is no rhythm, it will not shock, because shocking the heart is not important at that point of time. Shocking a irregular rhythm is important. There are 2 types, like shockable and non-shockable rhythm. Shockable rhythms are rhythms to be shocked, like ventricular fibrillation, any arrhythmias or anything that needs to be shocked to restore the circulation. Because what will happen if the heart is fibrillating? Usually heart compresses, the blood will go from the heart to the body. If it is defibrillating, what will happen? The blood will be here only. So it will not go to the body and there will be no circulation. For that we need defibrillation to restore the circulation. Okay. To restore it to a normal rhythm, so we can restore the circulation. We apply the AED at same point of time. We'll perform this demo thing for you also how we do these things. So after this 5 cycles of CPR, we try to assess for the rhythm. At that point of time, the AED will apply the AED, and once we switch on the AED, it starts analyzing the rhythm. Okay.
It gives instructions.
So if there are if the rhythm is shockable, it will tell us it's a shockable rhythm. I am shocking. All clear. And once it has shocked, it will tell again to resume CPR. Why to resume CPR? Because it has shocked. It has shocked the heart. At that point of time, the rhythm will regularize, but we have to support that part. Okay. So as you see in this figure, see, they have applied for AED. AED has instructed that it is shocking, so we all are clear from the scene. And once we get a pulse or patient starts breathing, we place the patient in a recovery position. That is the left or right lateral position with a hand. The hand which is below should be straight, and this hand below, and Why? Because if anything or any vomitus or anything is there, it will come out. It should not happen that if the patient is not in a recovery position, what will happen?
You were asking same question. What to do in case of consumption?
So this recovery position is helpful in this part as well. If any person faints, you can just turn the person to the left side or right side, keep his hand below like this. If you see this,
This is for
Then
unconscious patient
you can just
having
pull
breathing and circulation.
circulation. The patient is having breathing and circulation. You can
Both,
just
but
pull this leg
unconscious.
up and place the patient like this, person like this. This is a recovery position. So even if the person vomits, it will be down. ज़्यादा पार्टी हो गया रात में, सुबह आउट है, रिकवरी पोजिशन. So what? Now we have started with CPR. So अभी इसका complications भी रहेगा ना? What will be the complications? So we are giving chest compressions. So one is rib fractures, fractures of the sternum, any internal organ injuries, any lacerations over the organs or any sternum, vomiting, as I told you. नीचे ज़्यादा दबा दिया, patient ने खाया है या victim ने खाया हुआ है, they will vomit, vomiting, gastric distension because of giving this air, okay, or circulation. This can happen. You can save the life by giving CPR till the expert help arrives. चलो वापस रिवाइज करते हैं, क्या क्या पॉइंट्स देखे थे हमने.
दो पर्सन्स,
चलो 2 लोग आ जाओ,
दो लोग आए.
2-2 का टीम, 1 2 3 4 5 6 लोग है, 2-2 का टीम.